Hello. So today we have Dr. Rupesh with us, my colleague and my prosthodontist in our center. So he's with us today, and today we thought it is important that we discuss about dental implantology in general, and also in particular about corticobasal implants. The benefits of using corticobasal implants, both for the patients as well as doctors. So I hope we will have a fruitful interaction today. Yes.
Very true. I
Yes.
think probably people have many of them probably will be having a doubt as to what is this particular terminology.
Yeah.
Generally, people would have heard implantology as a term per se. But what is this corticobasal way, or what is this corticobasal implantology, is probably what is disturbing many of your minds when if anyone of you are planning to go for an implant procedure either now or in the future. Dr. Prasanth, as we know that we are living in a life where there is problem of plenty. I remember when we were kids, we probably had one ambassador car or a Fiat car, but now we have innumerable number of basically all of them are cars.
Yeah.
But we have a Mercedes Benz,
Exactly.
we have a Maruti, we have a BMW, we have an Audi,
And people are confused.
and people are confused. We have a Tata, but effectively, all of these are cars which will take you from point A to point B.
Yes.
So, similarly, I was just trying to connect this to implantology. Similarly,
Absolutely.
implantology is also, like I said, is an implant, which probably is, placed onto your missing bone, and a tooth structure made on top of it. So that is an implant system.
Absolutely.
But then, people are now confused as to, there are various systems, various type of implants. So, could you throw some light into what are the various type of implant systems?
We will do that. I think an introduction to implantology is very important. So we'll just quickly go through an overview of what implants are. So basically, dental implants are titanium pores which are placed surgically into the jawbone.
Right.
So which allows placement of the crown, which is replacement of the teeth. So either replacement of teeth or a bridge, taking support from the implants. Now these implants can be multi-unit,
Right,
two-piece or single-piece. There are so many options. So now what do you mean by two-piece implant? You can see this here. You have the implant, which is the first piece, and the abutment, which is the second piece. So there are scenarios where you have just two pieces, and then finally the crown comes on top. And then the other option is the three-piece, where you have the implant, the abutment, and the abutment is secured with a screw, which is seen here. And then the crown comes over that. At times, the crown goes in along with the abutment and the screw is inserted later.
Right.
So there are so many options. We also have one piece and monoblock implants, where the entire implant comes as one piece along with the abutment, on top of which the crown is fixed.
So generally, all these are dental implants.
These
like
are
you have
dental.
a diesel car, you have a petrol car, you have a battery-operated car.
Absolutely.
So similarly, you have one piece, two piece, or a three piece.
Exactly.
Yeah.
Exactly.
So I think most of you would have had your thoughts pretty clear.
Yeah.
As to what Dr. Prasanth was trying to explain.
Yeah. And this is the technique which is mostly employed, where they use a pilot drill and then they place the implant and then the abutment is placed and finally the crown goes in. So this is the general protocol which is being followed.
So basically, where the tooth roots are present, the implantologist will place a titanium post.
Yes.
And then you build a tooth on top of it.
Yes.
That's in simple terms.
Simple.
As to what a dental implant.
Very simple. Yes. That is it. So now I come to the classification, the strategic classification in implants. So we have crestal implantology and basal implantology. So crestal means it's always the superficial bone. Now in this image you can see the yellow shaded area is the crestal bone, and the pinkish shaded area is the basal bone. So when implants are anchored in the crestal bone, then you call it crestal series of implants. And the moment they are anchored in the basal bone, you have the basal implants. Okay. So now what is the peculiarity of basal implants? Basal implants are nothing but a merger of conventional implantology and prosthodontics with orthopedic traumatology. That is, in orthopedic surgery, there is no question of delayed loading. The fixation and the patient is mobilized immediately after the fixation. The fixation happens first and the mobilization happens immediately. So corticobasal implantology is where we merge both these sciences together and we are able to provide immediate loading solutions to the patient.
Okay, so that is the basic difference.
Yes.
Per se, if you say what is the difference between a conventional implant system that we generally see to a corticobasal implant, which Dr. Prasanth practices quite proficiently, is that it can be the patient's function can be restored immediately. So that is one major difference between these two.
Yes, that is a major difference.
So Dr. Prasanth,
and as I have highlighted in this image, you can see the fixation of the plates have been done through bicortical fixation. So the bicortical screws are engaging the bone and the plate has been fixed.
So the picture that you see now highlighted by Dr. Prasanth is an orthopedic
yes,
It's nothing to do with dental.
Yeah.
Dr. Prasanth is trying to explain to us the principle.
It is a merger. It is a merger of conventional dental implants with orthopedic surgery. Okay. So that is what it is. Now, I also do this comparison of soil layers. Whenever I try to explain things to patients, I always say you have the topsoil, which is relatively porous and soft. You have the subsoil, you have the rock fragments, and you have the rock deep down below. So I always liken this to liken the bone present in the jaws to the topsoil, which is the crestal bone, which is relatively soft. Then you have the mid portion where you have relatively harder bone, and at the base you have the rock. So in corticobasal, what we do, we engage or anchor in the rock below so that you have perfect stability and perfect anchorage.
Okay.
That is the beauty.
So the implants are placed basically in the basal,
in the basal
or the cortical, bone. For example, in your in the explanation which Dr. Prasanth just showed us, the rock part of the
bone. Yes.
Okay.
The rock part.
So what specific advantage?
I'm just coming to that. So the crestal bone is the alveolar bone, which I would liken it to the topsoil. Okay. So they are less resistant to resorption. Resorption means when an injury happens to bone, then the bone undergoes remodeling and it undergoes certain amount of degradation or absorption into the body, into the human body. That is what you call resorption. So it is less resistant to resorption, less repairing capacity following an injury, less resistant to infections. It is more prone to infections. It does not allow immediate loading. That is, we do not permit immediate loading when you place it in the crestal bone. It is mostly porous bone of low density, and the increased blood supply leads to excessive bone remodeling. So this is what happens. Therefore, the alveolar bone is not the right bone for immediate loading. Whereas in the case of the basal bone, the rock deep down below, it is highly resistant to resorption, faster and stable repairing capacity, highly resistant to infections, allows immediate loading, dense and more mineralized, and there is less or no blood supply, minimizing the bone remodeling. That is the beauty of the corticobasal implant system, which is anchored in the basal bone, which is either deep down or on the sides, as you see here.
Yes, sir. So the major structural difference between these two implant systems, I think Dr. Prasanth has just explained to us. Now, could we have a discussion on the major advantages that this particular system have?
Yeah.
Now, many of them would be doubtful when you
we will
choose.
come to that. I'm just quickly going through a few more slides to explain the point further. This is a regular conventional implant which has been anchored in the basal bone, and you can see all the crestal bone is lost because of the resorption and because of peri-implantitis. There is a condition called peri-implantitis where the bone is lost around the implant, but this portion alone is surviving just because it is anchored in good quality basal bone, and there is very little blood supply here, and therefore the bone is not undergoing any resorption. So this is a classical slide where it highlights the importance of basal anchorage, anchoring implants in the basal bone. Now, this is the depiction of bone resorption happening over years after extraction. So people develop bone loss and the bone shrinks, and finally, you're left with very little bone, which is highly mineralized cortical bone. So this is the bone which we trust. So this is another depiction of alveolar bone and basal bone. This is the alveolar bone. This is the basal bone. You can see the alveolar bone here and the basal bone here. And the conventional implant is placed in the crestal alveolar bone, whereas the corticobasal implant is anchored in the basal bone. So that is a classic difference. Here is another depiction of the same thing. And as you can see here, this animation shows the conventional implant and then the basal implant. So that clearly shows this is the conventional implant where you have multi-piece design. And I always compare this again in another way, where the dense bone is deep down and the porous crestal bone is up there, and the conventional implant is placed into the porous bone, whereas the basal implant is anchored in the rock below. So you can see that. So this is the peculiarity of cortical anchorage. So this is anchored in the basal bone. This is the floor of the nose, which is shown here, and this is anchored in the floor of the nose. Now you can also see here there is a principle called corticalization, where we compress bone while we place the implants, so that you develop a good quality bone around the implant surface by compressing the bone. Yes. So that is what we call corticalization. This is like
the kind of a principle.
Yes, densifying the bone. So that option is also available in this particular system with corticobasal. And the other beauty is, you can see this, the implant is placed in a particular way and we've bent the abutment. So what is happening, we are anchoring the implant in very good quality bone wherever it is available, and then we are bending the implant so that we are able to place the teeth in the right angulation, which is also very important. So you can see the implants are placed and then finally they are bent to ensure that they are straightened, the abutments are straight. So this helps in insertion of the prosthesis in a much better way, which is a huge advantage. And we also modify the abutments to ensure that we are able to anchor anchor the prosthesis in the right way, and we are able to cement the prosthesis onto the implants. So that is another depiction of conventional implant and the basal implant. And in this picture, you can clearly see when there is bone loss, with a conventional implant, you have to add bone with the help of bone grafts, build up bone with the help of bone grafts. Whereas in corticobasal implants, you don't need to do that. We are anchoring it in the basal bone, and that really takes up well. So that is a classic difference. You can see the difference between the conventional and the basal here again. They are much longer, they are thinner, they are polished surface, and there is no question of bacterial colonization here creating infections. So there are multiple advantages with the corticobasal design, where we anchor it in the basal bone. And the beauty here is that unlike the conventional implants where you have to modify the bone to suit the implant, here we choose a design of the basal implant to suit the available bone, which is the beauty. That is another depiction of the conventional implants and the basal implants, so that you have an idea. And we have a wide variety of designs from which we can choose based on the bone quality and quantity and the alignment. So based on that, we are able to choose one of these designs to ensure that we are able to provide immediate loading to the patient. So I think I've given you an overview of the comparison between the two systems, but we'll come to the details of the patient friendliness during a different episode.
Thank you, Prasanth. Dr. Prasanth, thank you for that, in-depth explanation as to, the basic difference between these two systems. Like we said initially, both are implants, both serve similar purpose, which replaces your missing tooth. But, the choices, like I said about a Mercedes-Benz to an Audi, or, the difference between these different implant systems, it has its own mileages, advantages, disadvantages. I'm sure Dr. Prasanth will be explaining to us in the forthcoming episodes. Thank you for listening.
Thank you very much, Dr. Rupesh, for being here with me. And we hope you liked the video. I know we've gone too technical, but I'm also sure that many of our patients are very keen to learn the technicalities behind the treatment principles, which is why I went in a bit technical. And we hope you liked the video. If yes, please subscribe to our channel, and please like the video, and do share this among friends. Thank you very much. See you soon.